Are you aware of any oral hygiene practice which you should follow during this COVID-19 pandemic which will keep your family a little more safe? Hi, I'm Dr. Sonal Naidu from eDentofascia. I'm here with you to discuss two of the important oral hygiene practices which you can maintain at your house and keep your family and your loved ones a little more safe. Times are very tough. Our country has been in lockdown for almost 6 to 7 months, and it's not possible that all of us can stay inside home or work from home. There may be few members of our family who need to go out to work, and there are always chances that they might bring in the virus along with them. We all are at the danger of contracting the disease and more so spreading it to our loved ones. Let's take a little step so that we can avoid this spreading. The first thing which I want to mention here is families have this habit of stacking the toothbrushes into a toothbrush stand. All the toothbrushes are kept together. The person who's traveling outside, you can just keep their brush a little away from the brushes of the people who are staying inside. People who go outside are always at the risk of contracting the disease and bringing the virus along with them. So what we can do is just keep their toothbrushes a little differently, or at least at a different place. Toothbrush is in direct contact with the oral cavity, and we usually just wash it with water and we keep it at the stand. So if the toothbrushes are in contact with each other, there is a lot more chance that the virus may get transmitted through the toothbrush to the toothbrush of the family member. Second thing which I would want to tell you is, if at all you all did not contract COVID, but you have had a simple flu or a simple bout of cough or runny nose, and it was just for 2 days and you did not get a test done and you are all fine, you quarantined yourself and now you're fine, still change your toothbrush. Never, after any viral bout, if at all you have a viral stomach infection also, I would urge you to keep the toothbrush aside, just throw away and take up a new toothbrush. The next most important thing is, if any member of your family contracted COVID, unfortunately, and is fine by now, and is back to home from hospitalization, or is back to home from home, as in back to family, inside the family from home quarantine, what you could do is just change their toothbrushes. I can say this with the first-hand experience. My dad did contract COVID, he was hospitalized, he's back home, and he's back to his office also. So the practice which we did was, I changed his toothbrush when he was going to hospital, so that the toothbrush which he was using and we could not realize that he's actually having COVID, we just threw that toothbrush away. When he came back from hospital, we had to quarantine again. We have to again quarantine him for 14 days. That is the post-hospitalization protocol which is followed everywhere. I changed his toothbrush again. And next was when he was out and about with all of us, I changed his toothbrush again. What we are doing when we are keeping the toothbrush away or we are changing the toothbrush is, we are just minimizing the chances of virus getting transferred through toothbrushes to the toothbrushes of the family. So changing toothbrush is a better option. I would not suggest you to sterilize or use any chemical solution onto it, because again, we have to keep our toothbrush inside the mouth. It is something which goes inside the mouth and cleans it. So I would highly recommend that if there's anybody who has had a little bit of viral infection, COVID, non-COVID, just change your toothbrush. Dentists have been giving this advice since long, that after any viral infection you should change your toothbrush. People have never taken it seriously. I have seen people using the same toothbrush. Patients come and tell me they have been using the same toothbrush for 12 months or more than a year. But this is the time we need to be very cautious. Every single step which can keep us at a little distance from COVID, we should take it. There's no foolproof method by which we can keep COVID all away. But if there are these little things through which we can just keep our family and our loved ones a little safe, why not take it? Again, coming to eDentofascia, we are an online platform for dental solutions. We do online consultations. We have some fabulous subscription programs. The website will be live soon, and I'm so excited to share this with you all. Stay tuned, and please like this video if you feel that this content was a little useful to you. Share with your friends and family so that they can also follow this and we all can be a little safe together. And please subscribe to the channel. I'll be coming up with more such informative dental and oral hygiene related videos, and I'm sure there'll be a lot of help for everyone, from the kids in the family to the adults and grandparents. Stay tuned and stay safe. Thank you.